Wherever the subject of human health and well-being is mentioned, so too is the obesity epidemic. Being first coined by the World Health Organization in 1997, the term refers to a universal increase of excess body fat over the past 3 decades and the toll it has had on the future of humanity. Such a development is alarming, as it reflects on oversight in the way people are encouraged to behave as well as the effectiveness of current weight loss solutions. To greatly understand the many ways in which obesity can be countered, this video will walk through and gauge the effectiveness of 4 common weight loss solutions. Those being plant-based diets, exercise, bariatric surgery, and weight loss counseling.
In order for someone to understand what obesity is, and then find solutions to the problem, a person must understand the definition of the actual problem. A person who is classed as overweight or obese is defined to have an abnormal or excessive fat accumulation that is defined as a risk to health. Generally, a person is classed as being overweight or obese officially through the BMI scale. This scale is a solid approximation for determining whether or not a person can be classed as overweight or obese. How the BMI works is that the system takes into account a person's height and weight to determine whether they are at a healthy state or not. If a person gets a BMI score of less than 18.5, they are classed as underweight. Between 18.5 and 25 is classed as normal. Between 25 and 30 is overweight, and 30 or more is obese. All a person would need to do to work out their own BMI is just know their height and their weight, and they would be able to work out what category they'd fit into. Whilst this isn't a 100% perfect indicator, a person who is classed as overweight or obese has increased risks of non-communicable diseases such as cardiovascular diseases, mainly heart disease and stroke, diabetes, musculoskeletal disorders, and some cancers, including endometrial, breast, ovarian, prostate, and many others. Now you know what obesity actually is, it's important to be aware that this isn't just an isolated issue in one country. Obesity is a problem that is ever present in our society today, and its impact on our world today has drastically increased over the past few decades. As of 2016, more than 1.9 billion adults, 39% of the adult population, were overweight. Of these 1.9 billion adults, 650 million, 13% of the total adult population, were obese. To put this number in a bit of context, this means that almost 75 times the total population of Australia is overweight, and almost 26 times the total population of Australia is obese. Remember, the 1.9 billion is just in the adult population. We haven't even taken into account childhood obesity. According to the World Health Organization, the obesity situation has gotten so bad that it has reached epidemic proportions globally. The way I see it, when at least 2.8 million people are dying each year from being overweight or obese, I think epidemic proportions is a bit of an understatement. Based on many different bits of data that the World Health Organization has collected, this organization has concluded that the prevalence of obesity across the world has tripled since 1975. And ultimately, if nothing is done to stop this increase, the situation is only going to become much, much worse.
How does having a plant-based diet help solve obesity? Plant-based diets have been in scientific contention for years on whether or not they solve or impact obesity in any way. Research has shown this to be inconclusive, but some may say otherwise. In a study with a cohort of 50,000 Taiwanese adults, the percentage of participants with a BMI of 27 was significantly lower than those following a vegetarian diet of around 10.9%, as compared to those following a non-vegetarian diet around 15.4%. Additionally, this study also found that every year a vegan diet reduced the risk of obesity by 7%. You could come to the conclusion that repeating statistics like that across many studies proves that it works, but plant-based diets require planning, reading labels, and discipline. This disciplined diet is the preferred explanation for the decrease in obesity and not the diet itself. Plant-based diets also come with multiple risks of deficiencies, including iron, vitamin B12, vitamin D, calcium, and fatty acids. How does exercise help solve obesity? The massive scientific evidence supports physical activity as an important lifestyle behavior for the management of body weight. This includes prevention of weight gain, weight loss, and minimizing weight regain following weight loss. The evidence also supports that physical activity may need to be moderate to vigorous in intensity at a dose of at least 150 minutes per week to influence body weight regulation. Moreover, there is strong evidence that the dose of moderate to vigorous physical activity necessary to enhance long-term weight loss and minimize weight regain is the magnitude of 200 to 300 minutes per week. Thus, it's important to consider the strategies that may enhance engagement in physical activity in adults who are overweight or obese. One approach that may be effective to encourage the accumulation of moderate to vigorous physical activity throughout the day by increasing steps of ambulatory movement rather than focusing solely on structured periods of more traditional forms of exercise.
One of the ways to overcome obesity is through bariatric surgery. So, how does bariatric surgery help solve obesity? A more advanced but admittedly costly method, which has been proven to reduce the chances of obesity, is known as the bariatric surgery. A surgery that reduces the size of the stomach and thereby the appetite of the patient. There are three major types of bariatric surgeries in Australia: lap band, gastric bypass, and gastric surgery, all of which focus on different areas of the stomach. Bariatric surgery is one of the most effective solutions to obesity, with a success rate of 85%. This 85% of patients experience weight loss of 40 kilograms on average, roughly 15 BMI points. Another way is through counseling and advice from all doctors and nurses. If a person is struggling to work out how they can lose weight and reduce their chances of any health repercussions of become overweight or obese, getting advice from doctors and nurses can be helpful in finding a way of losing weight, which works for any particular person. Primary care doctors and nurses are well placed to provide evidence-based preventive health advice. This advice can be very useful, specifically if anyone is stuck for advice on what weight loss strategy would be best for them.
Although individual autonomy will always ensure that obesity remains a societal issue, the current standard of weight loss treatment proves that there are many adequate solutions in reducing its impact. Out of those observed within this video, the most immediate solution to obesity is bariatric surgery through its ability to force the body to lose weight. However, the most guaranteed way of overcoming obesity concerns the implementation of significant lifestyle changes such as plant-based diets and regular exercise. As surgical technologies become more effective in making physical alterations to the body, further questions must be asked about the ethics of body alterations, as obesity is more commonly a self-inflicted issue.